now I've got mixed emotions because I just met Chief Scott, and I'm told that he was a player at the University of Kentucky football, and I played a little bit of football at U of L, but I was not very good, and you can see the height difference, and I imagine he had a lot more time on the field, but I did just want to say thank you to all of you all for joining me here today in this effort. And good morning to all of those that are watching and listening. I appreciate the commitment to confronting the drug epidemic. It's obvious that to all of you all that are here, that this year has presented some very uncertain times and some very trying challenges. The pandemic specifically has created unprecedented challenges for every Kentucky community, and has created what one Kentucky newspaper referred to as the perfect storm for Kentuckians who struggle with substance abuse and substance use disorders or are in recovery. The need for social isolation measures, limited access to support resources, and the mental health challenges created by this pandemic are especially difficult for these Kentuckians. National data, while preliminary, is showing an alarming increase of overdose deaths across the country since the start of the pandemic, and suggests that overdose deaths are on track to reach an all-time high. Kentucky's numbers are sadly showing the same trend. I was in a meeting this morning and one of the participants said that as it relates to the drug epidemic, it's important that we don't have a lot of happy talk, that we talk seriously and openly with candor about the challenge, and that's what I hope to do this morning. There are certainly no simple answers, and addressing the drug crisis will continue to require a multifaceted and collaborative approach from elected leaders, advocacy organizations, and communities from across the Commonwealth. And this is a top priority for my office, and one that I'm committed to partnering with those represented here to address. We each have a role to play in stemming the tide of the drug epidemic, and there are simple but meaningful ways to make a difference, including the proper disposal of unused and expired prescription drugs. The 2018 National Survey of Drug Use and Health estimated that 9.9 million Americans misused controlled prescription drugs. In the wrong hands, expired and unused prescription medications can lead to overdoses, drug abuse, and accidental poisonings. Each year, the DEA hosts a National Drug Take-Back Day to raise awareness about the proper disposal of prescription medications. This year's Take-Back Day will be held this Saturday, October 24th, from 10 a.m. to 2 p.m. There are 43 drug disposal locations across 26 Kentucky counties where you can drop off unused and expired medication. Two of these locations, in fact, are in Madison County, the Kentucky State Police Post 7 and the Richmond Police Department. And you can also visit takebackday.dea.gov for a full list of the take-back facilities. During last year's Take-Back Day, Americans turned in nearly 883,000 pounds of prescription drugs at nearly 6,300 sites operated by the DEA and almost 5,000 of its state and local law enforcement partners. The DEA, along with its law enforcement partners, has now collected nearly 6,350 tons of expired, unused, and unwanted prescription medications since the inception of the National Prescription Drug Take-Back Initiative in 2010. As well, the Kentucky Office of Drug Control Policy has identified 193 permanent prescription drug disposal locations in 116 of the Commonwealth's counties. One of these sites is right here at the Berea Police Department. And again, you can view the full list by visiting odcp.ky.gov. I encourage everyone, every Kentuckian, to make a plan to properly dispose of your unused prescription medications so that they don't pose an unnecessary risk to children, family, and friends. And to assist with this effort and to underscore our commitment to ending the drug epidemic, today we're donating 200 deterrent deactivation system kits to the Berea Police Department. These kits provide a safe and easy way to neutralize unused or expired prescription pills, liquids, and patches. To use the packets, you simply place unused medications in the pouch, fill halfway with warm tap water, and then you wait 30 seconds. You seal the pouch and then gently shake the contents. This will neutralize the prescription drugs and allow for them to be disposed of in a regular trash can. It is my hope that the deterrent packets will give law enforcement another tool in their toolkit to fight back against the drug epidemic and will prevent prescription drugs from falling into the wrong hands. This is one way that we can together, collaboratively, address the drug crisis in our communities. So let's all do our part in participating in the upcoming Take Back Day this Saturday, October 24th, and by making a regular effort to drop off unused prescription drugs at the permanent drop-off locations around the state. Thank you and God bless. And again, I just want to say and convey to everyone here that those that are standing next to me here and to our men and women of the Thin Blue Line, to all of our law enforcement partners who are undertaking daily the responsibility of interdicting drugs to make our communities safe. Chief Scott just talked about keeping Berea safe. It's important that we keep all 120 counties safe, and we have to continuously be committed to this effort. We don't want to take away from the immense and enormous responsibility that we have as it relates to COVID-19 and keeping our people safe in that regard. But we also have the responsibility, as everyone has so eloquently stated, to continue the effort and fight to push back against the drug scourge because it has impacted so many families. I was just over in a meeting with Hope's Wings, and I saw in one specific area where abuse can harm. Of course, this is Domestic Violence Awareness Month, and how harm that is done to spouses and significant others can have long-term effects and consequences. The same is true with respect to drug uses and substance abuse disorders. So I'm here along with everyone else to say that enough is enough. We're going to continue to fight this fight, and with your help, we will push back against this scourge. So thank you. I appreciate it. At this point, I think I will open it up to folks for a few questions, if they have any of me or of Representative Frazier or Senator Carpenter or Mayor Fraley and my newfound University of Kentucky football friend, Chief Scott.